Good afternoon, everybody, and thank you for coming. I know when I start seeing July, I am getting a little nervous. 75% excited, 25% a little bit nervous because I'm like, the days are like crunch time now. But anyway, thank you very much for everybody decided to come today and joining this meeting. I know anybody who is traveling, this is the meeting because everybody wants to know how much. But I'm gonna make you wait a little bit longer. Let's discuss other stuff first, and then we get there to discuss the budget, which I think everybody wants to know that. But we have to do other stuff versus just getting to the final price. So first of all, I need to thank all the people who are very, very active helping preparation of this medical mission. There is no way I would have been able to do by myself. There's no way. And there's 31 people confirmed right now, and then 3 they're still lingering. But I am grateful. I prayed for 30 people to 40 people, but God has blessed us and blessed the organization. Now we have almost 33 people. So Tanzania, here we come. Anyway, so I prepared a little summary of certain little things. So I'm going to try to go as fast as I can to save time. So you guys have, I know you're going to have a lot of questions. Please ask the question, because sometimes I may assume you understand those things and then you don't. And I want to make sure everybody's more informed so you can be prepared and get ready when we get there. I don't want any surprise. I mean, sometimes it will be surprises, but I want you to have surprise and say, oh, I wish I knew I could have brought, you know, I don't want to do that. But if there's any questions, please ask. The question that you don't ask, probably 3 or 4 other people are thinking exactly the same thing, but they don't have the strength to ask, but please ask. And if there's something that I'm going to address later in document, I'm going to say, okay, hold on to that. I'm going to ask that. But I don't want you to be behind and start wondering, okay, oh, I don't know if we can do this or do that. And as I said, I'm just going to give a little highlights, not all the details, because we never leave this place, the meeting. Although it could be nice, but anyway, no. We're going to hang out together for those 2 weeks, and that will be exciting time. So again, welcome to the general meeting. It was supposed to be for June. Unfortunately, the 2nd now, because we already do the last Saturday for the month. But last week it was a little bit too soon. There's a lot of negotiation going around, and that's why I said there's so many things behind the scene. Like we have a bigger group, so I'm trying to get the most discount I can get. And so that's why it's like back and forth. And when I'm just prepared, when I'm gonna give you the budget, certain things are gonna change. So I'm gonna give you the budget as if you are going to stay on your own, independent, like a single room and everything is independent. So that is gonna be the maximum amount people will pay who are doing by themselves. But if you are sharing a room or you are willing to do some of the accommodation that they're provided, you're going to pay way less than that. Probably the difference could be almost $300-400. So let's just, when I give you the number, so don't freak out. It still is less than what we did last year, because last year the estimate was 28 something. So this year with the maximum amount and without any discount from all, it's almost 27 something. Yeah, almost 27. So we're still going to have way less than that. When I say 2,700 is like including your ticket, your visa and all the stuff. But remember, the ticket varies because it depends on when you bought the ticket. So that's why the amount is going to be less and less. So, okay, so let's start in. Unless if somebody has any question, they want me to start with that part, I'll be happy to do that right now. Maybe.
Tanzania wanakuja.
So you see the agenda, they said, we are so excited. There's a lot of training and every volunteer is going to be involved, even if maybe you're not like a lead facilitator, but you're still going to be involved no matter what. We've been doing a lot of training, and thank you for all the facilitators who have been participating to lead those training. And we have receiving a lot of people from Tanzania. We're still working on logistics and increasing the number of attendees, but so far it has been great. We had already 4 classes, and we have 5 more to go until September. So donation, of course, you're still asking for donation, and there's a lot of amount that we want people to continue donating. It doesn't matter how much it is, even if it's $5, $10, an amount that is appreciated, because that will help to bring down and help us accomplish what we need to do. So anything that you can help, and even if you can get friends and families, even if they give a little amount, it's fine. Like last year when we were collecting, even the lowest amount was like $5, because we had like a backpack fundraise. $5, and people are like, okay, I'm gonna buy at least one backpack for a child. So all those little things does add up, and we can keep getting stuff. We do have a lot of updates. I mean, a lot of, as I said, 31 people have already confirmed tickets wise and insurance. And then, so what is the next thing is gonna be the invitation letters and the visa. So we're gonna get more stuff. And then of course the homework, because everybody has homeworks and people have been submitting. I think so far we have only like 35 people completed all the stuff that they need, but like the rest, please start submitting those things. We need to get going to make sure we have the information necessary. Oops, my screen was frozen. Okay, let me see. Donation, also fundraising for different areas, activities. So please, if you can give out your time, because you can select even one area. Let's say, for example, Janet was focusing on a backpack, which thank God, and then she has been able to raise more than half of the amount needed. And then, so we need to continue raising money. So anybody else, any volunteer or any member in the group or friends in the group can just select, okay, maybe I'm gonna help with notebook. So because the notebooks are a little bit heavy, we appreciate if you can give money and then we go and buy them from Tanzania. And then if the advantage of buying them from Tanzania is because we can put the logo, the QHSC logo on those notebooks. So all the kids that are getting those notebooks will be, we have the logo so we know where they're coming from, so that will be even easier. That will help us to save from the shipping stuff. We try to do everything we do right now in Tanzania, and promotion wise, we do the QHSC, like brand, they call branding. So everything. So you see like all the t-shirts, all the activities, stuff there, all be QHSC, this QHSC, that QHSC virtual, QHSC, whatever. So we are trying to make sure our name is known everywhere else. So it becomes a household name. And anybody, when you, next time we say, oh, I work with QHSC, or I'm a member, or I'm a board member, or I'm, you know, like an active member in that. So everybody should know what it is. We're also going to be getting the scrubs and t-shirts from the QHSC, and we're going to let you know soon, because thank you, Bree, for working on that to try and get the most discount we can. And then, so the more discount they give us to those prices, then at least the more items we're going to get. Like right now, we're hoping to get like one scrub set for majority of people who are going to the hospital, and then 2 to 3 t-shirts for people who was, everybody's going to get 2 to 3 t-shirts. So we are still working on the colors. We're going to ask you, when we're ready to put an order for the t-shirts, we're going to ask you for the colors, and people who wants to volunteer designing those t-shirts, we are welcome. And when we announce it, please volunteer, because I said it's a crunch time. So when you need to put that order, definitely before a month and a half, which is be like in 2 weeks, we need to be able to put that order. So when I post and said, okay, guys, we are ready to post an order. So if you want to be graphic designer, please show up, and then we can work on that as fast as we can. We already discussed that part. So now we have only 3 airlines so far. We have Turkish, Emirates, and then some people who bought a ticket a little bit late were able to get it from KLM. And then so only a few people arriving on the 11th. Majority of the people were arriving on the 12th. So we're going to start doing accommodation from the 11th, and majority of people are going to 12. So when I'm start doing the individual budget, when you start talking to each other and make sure with all those discounts and stuff, when you select and tell me, okay, I'm arriving there at 10, so we're going to make an arrangement that you're going to have an extra night versus the people who are arriving at 12. So we're going to discuss that individually to make sure you're paying only what you're supposed to and not more than necessary. Invitation letter, definitely we have to make sure we have them by the end of the month. However, we are aiming at least within 2 weeks. As soon as we get the letter from the hospitals and school, we're going to start sharing how to apply for the visa. So the visa is going to be, we're going to get similar visas, which is the mission visa, and it's going to be $100. And then you're going to apply that with a stipulation that you're going with a group. So you get those instructions, don't even start worried about that part. It's very simple things if we give you the step-by-step how to register, so then you can get your visa very quickly. And it doesn't take that long. I think the last time when we were applying for visa, it takes only 3 days. They told us like a week, but in 3 days, usually I say as soon as they get your money, they have to give you the visa, so which they did that. And as I said, it's a very easy process, so don't worry about that, but we guide you as soon as we get the letter, and we'll give you your step-by-step, what information to put, which director you need to put on that information, the dates and the whatever, everything will be given. And then usually it's the multiple entry visa, meaning like you're getting the visa for a whole year. So we still have to come back within 3 months, and then you can go back in Tanzania. So if you are getting so excited about this medical mission, and then in December you want to go vacation to Tanzania, you still have the visa. You can go back and forth. So if you want, that's good for you. We were working with the licensure. Thank you very much, Dr. Sambichaka, for working diligently with leadership from those hospitals, Buguruni, Mwananyamala, and Muhimbili. We are lucky enough we got the exemption to not pay for the licensure. So people who are nurses and doctors, thank you. So that one, when you're doing the budget, you see will be minus $100. Yay. So for the budget, as I said, expenses, if you can submit those expenses by the end of the July 29th, so we'll be able to pay for those accommodation and hold the places. For the hostel, food and transportation, we'll secure those things because, as I said, September is very close. But I'll keep sending those updates, and everybody will know what they need to do. Okay, hold on a second. My phone keeps binging too much. Okay. This is one of the preparation. How do we prepare to go to Tanzania? This was only a sample of things that we need to prepare for. The passport, definitely you have to have a passport, and majority of you guys, thank God, we have passports already, and as I said, the ticket is gonna vary for when you bought the ticket. And then travel insurance is gonna vary, depends on your age and the amount of the ticket you paid. So far as I know, majority paid from $25 to $75. And the person I think will pay $75 is because the ticket was, I believe, $1,400 or $1,500, because it depends on where they're coming through the country here. This guy said it should be very cheap, and the coverage is adequate so far for what we've done. We are going to do so, and I trust that God is going to protect everybody, so we don't need to use it. Visa, as I said, is $100, and then the temporary license, I mean, it's not, the money is not there anymore, and thank God even for the doctors, they don't have to pay the $500. Phew. Packing of the scrubs, I have a little itemized list of how many things we need to cover. This is not inclusive. I mean, we might get some more or update from Tanzania that they want to add those things. Then I will let you guys know. And then the accommodation, food and stuff, everything is included. Once you pay that money through Cash App, you don't have to pay anything out of pocket other than if you're going shopping, then you buy stuff for yourself. So that's fine. Electricity, of course, we do need to have the adapters. I know a lot of people have been buying the adapters, and I think there was 2 adapters donated. So all those adapters, we buy it from Amazon, and then you can use in US, you can use in Tanzania. It's usable everywhere else. I know a couple of people were asking about the insurance. So the insurance, as I said, it's varies for how much you paid and stuff. So the coverage that we were looking for was if they cancel your trip, the trip should be covered 100%, so you get back your money. Let's say something happened to the plane or whatever, like that time when COVID happened, they canceled, nobody can travel from here to Tanzania or Tanzania to here, so then you get your money back. And then any interruption, delays or whatever, then if they need the ticket, your money back, you're gonna get the 100%. Medical evacuation is 200,000 per person, so which is, I believe, could be adequate. And as I said, that's why everybody has the policy. And those, as soon as you register and get that, the enrollment email, please forward that email, because I want to make sure we have all those policy numbers and stuff. So, because I will need to leave it with either Valentine or Miss Annie Schneider, people who are remaining behind here to help us, just in case if we need it, so they can call the insurance company and get those support as soon as we can. So if I don't have a copy of yours, it's hard for me to know where, on what information and who to call. And then even if I know what company we bought from, I don't know the police number. And you know, if you don't have a police number, more likely nobody's going to give you the information. First of all, I wouldn't even know. They wouldn't. I'm not even on your list to get the information if you need an emergency response. So it's going to be hard. But if I have a policy for you, I can just say, okay, she or he is in my organization, and this is what the police number, and this is her name, or this is his name, and then so you can get covered. So please send me those enrollment email. Just when you receive it, just forward it the way it is. You can print the copies for you, but remember, if you need an emergency, you're not going to be able to start looking for that part. If something happens at the hospital and you left it at home, I mean in the hostel, it's not going to help. But if we have it electronically, we can access and get you the help or you need immediately. If we lose the bag, hopefully it doesn't happen. There's $750 per person, and then any accident and stuff. We're praying nobody has going to succumb anything about the last option. We don't want to talk about that. Homework, I already sent this little screenshot to say, okay, give me the your passport and expiration date and pictures and all the stuff. We need those information so we can create the profile for the organization for people who are there. Remember, we are going to outside the country. It doesn't matter even if you're from Tanzania. You're going there as a group, so we need to have that information, and then we can access it as immediate as we can. And that's the part also I was asking about the emergency contact. So if there's something happened, I need to be able to find your family members to access, to find them and update as soon as I can. Versus start struggling and start looking through friends and stuff. We don't have time for that. We just want to make sure we contact the emergent person you recommend for us to get them. And I encourage them to get those family member or the person that we want us to contact into the group, because then they will see what everything is happening in Tanzania. And then if maybe they don't, it might be too many notifications. If they want to leave after the mission, that's okay. But I just want them to be able to see them. And if there's something happens, they'll be easily finding out, and then we can contact them. So please let me know then contact numbers and the phone number using the WhatsApp, then we can add them to the group. I do thank people who have sent the statement why they selected to be in the medical mission. We use those statements. We're going to use that, especially in this month of July and August, to try and ask for more money or inform the public what we're going to do, so they will see the preparation, and then they'll be looking forward to engage or support us during the medical mission. They see what we're doing. We are going to sign those hold harmless agreement in the end of the month. Usually I wait until we get the visa, and then we can get that information. So that one, Mr. Parankasiakabe is going to help us with that, because since his area of management is including the safety briefing and stuff, so he's going to help us with that. That'll be more like the next meeting. Application of visa, I already said, this is the link, but don't worry about that part right now. Wait until we get the invitation letter, and then we're going to start. So, because if you go to start right now, they're going to ask you a lot of questions that you don't have answers. Because one of the questions, for example, they're going to ask you the director of the hospital that we are going to, who is going to know where you are there. You don't have that information right now. We are waiting for them to provide us, and then so everybody will have the similar information. So, but this, if some people usually wants to plan ahead and look ahead, that's fine. You can go in there and browse using that link. I'm going to send that document to everybody else after the meeting, so don't worry about start writing it down right now. Okay, so the next thing, we are grateful that the COVID has been coming down, or whatever you want to call it. But as of June 12, this is the website from the CDC, have explained that we don't need to test for COVID when you're going over there or coming back. So those are the things that we need. We're grateful that we don't have to spend that $125 on that expense thing. So, but still, we want to make sure everybody has their COVID shots. And if you needed a booster, then you have your booster. And I remember Dr. Msambichaka sent the link from the public health or something. So we can go and get those documents that we have a list of all your shots. Yes, I know some of you who will send the information, you send me the actual copy of actual card, that's fine. But I think Dr. Msambichaka was suggesting to get that letter from, or the document from the government official website. Was that right, Dr. Msambichaka?
Yes, I think so. Every state usually, well, I should say most states, because I don't know every state's policy. You do have access to your vaccine information from the state website as the patient. So if you go to that website and just download, there's an option to do a QR code, and then you can just download that information on your phone on an app. That is the easiest way for you. Even if you lose your card, you will have that information on your phone, and that is considered more official than the card, because there have been forgeries with people, those that have access to the vaccine cards, just forging and writing the information on there. So that's why the preference is to have a state downloaded vaccine information.
Would you mind sharing that link again, Dr. Msamichak, on the website, on the group? Sorry.
Yeah, I'll do that. That is just an example of what the Delaware vaccine information looks like. So if you're in a different state and you can't find it, just send me a message and I can help you locate where your state vaccine information is located, and then you can download it that way.
Okay, perfect. Thank you very much.
Oh, okay. You know what, Harriet, I was just going to also just remind everyone that I know you were mentioning the shots and the boosters and everything, so everybody try to be as vigilant as possible, because remember, not only are we dealing with countries, but we're dealing with organizations or institutions. So hospitals are going to have their own policies, schools have their own policies on all that stuff. So we just want to make sure everybody's got all their stuff together so we don't run into any problems.
Thank you. There was the original message I sent to you guys with shots that are required, and I think I did send like a screenshot to it. If somebody doesn't have that one, let me know. I can just forward it to you, because that's the one you can take it to your doctor, and then the doctor more likely should go to the CDC website to see. It matches, because that's what we copied from there. It matches what the Tanzania requires us to, what type of vaccines we should have, and then what the dosage of the medication we should have, prophylactic medications. And then what are the other medications you can ask just for prophylactic purposes to make sure we have what we need. And I'm sorry, Dr. Msamichak, I didn't ask you before, but if they have any questions about the medication or something, can you help me just to explain to them or guide them what questions they can go and ask their doctors for further assistance?
Sure.
Thank you.
I would be happy to.
Thanks. Okay, now, what things to pack? So this is just a sample. We might probably revise it as we go if we find out something else could be beneficial, or if somebody have already traveled before and they think, people who went to the previous medical mission, if there's something that you think maybe an item that it could be added to the list, that's okay. I mean, remember, I live there, so some of the things I might see is normal for me, it might not be normal for other people. So if somebody have anything to add to it, that's okay. So as I said, we're gonna give you 2 to 3 t-shirts, so you can still bring t-shirts. We don't want anything that's fitted, whatever. No, just anything loose, because you're gonna be sweating. It's hot over there. You might be walking outside the buildings, maybe the short distance to get to the transportation stuff. So you are gonna sweat. So anything tight too much, it's gonna be like almost you're coming from the gym. We do need to look professional every single minute we're there. So scrubs, people were asking me how many, so I can say a sample of probably 5 to 6, it depends on how it is. As I said, we're gonna give you one full set for people who are in the hospital. And then dark colors, I mean, remember, it's gonna be dusty when you walk outside. White, you wear probably if you have your car and go to the hospital or whatever, it doesn't require walking outside for much. But in Tanzania, we are going to be walking outside. Maybe some of the training might be done outside, talking to people outside, or the nurse or the doctor stop you on the way, whatever. So it's going to be dusty and, like raining or something, that you don't want bright colors. So we prefer like either like royal blue, dark blue. Black is going to be an issue because it's going to be hot. But at least the dark colors that doesn't show dirt during the day and stuff. Remember, we'll be sitting on the either the Uber or shuttle, which is not your car, so the cleanliness might not be to your standard. So I don't want people to be like, oh, I'm sitting on the white now, it's ruining and getting me be miserable the whole day. No, we're just going to be there focused and try to do the best we can. So we can wear dark colors that does not show the dirtiness, but that does not mean that it's going to be dirty because we wear them for 5 days without washing. I don't mean that. still we have to be clean and stuff, but at least when you're moving around during the day, we don't want to be looking like the dust everywhere you go. Sunscreen, of course, mosquito and bugs repellent, those are recommended because you're going to hot tropic area. So anytime you sit outside, the mosquito bugs, if you're the few ones that the bugs loves you, they're gonna follow you everywhere you go, yes. Long pants, especially, for example, if we go to the safari, you don't want to have your skin exposed because you're going to get those bugs biting you. So just something comfortable, those khaki pants, you know, like all those with extra pockets, you can do those things, that's fine. When you're going to the hospitals or school, we don't want to wear jeans. Jeans is a big no-no. I don't want to see anybody wearing jeans. I don't want to fight with anybody wearing jeans, especially those with the holes. Culturally, I don't think people will are open or flexible or like here in the United States, but so covering skin is recommended. I don't mean like you wear the hijab, no, I'm just saying covering your skin, don't want to expose the stuff. Tight stuffs are not acceptable. You can wear jeans when you're going to the safari, you know, like a weekend, that's fine, but not for school, not for the hospital. When you're doing the exercise groups, then you can wear those things that you're doing exercise with. When I'm talking about exercise with, I don't mean like those kind of like a yoga pants and stuff. The one that you wear here in the United States. It has to be something loose, presentable. As I said, we're going to be on display. You don't know who is going to take a picture, who is doing what, and at what time. We need to be presentable and carry ourselves as professionals. Of course, the adapter, I already added the adapter, at least one towel. I mean, when we go to the hostel, I don't believe they give a towel. Even if they do, I would still carry one for myself. So I will encourage you to do the same, at least one towel. Toiletries, I mean, it's not like you're going to the hotel here in the United States and then you have all those little shampoo and stuff. Now, please pack your own. Not those big ones you can pack through because we're going to have check-in bags, so that'll be fine. But at least you have all those toothbrush, toothpaste, and ready to go. I mean, like the soap and stuff. Some people carry the bar soap. Either maybe they wash their underwears at night. That's your choice. I don't think they have the washer there, but usually they say they have the people who can do your laundry. So I am kind of skeptical because I've never stayed in the hostel before. Probably there might be people who can do that. It's fine, but I'm not going to rely on that and plan for that. So if you can plan, pack as much as you can, but as little as also can, because you're not going on vacation, just pack the necessary thing that you need the most. And then of course, we might have a couple of days, people can go shopping in the evening, organized shopping. So it's not like people are going to just wander off, but because remember, your safety is our priority. So I don't want people to go out there. You don't know the people, you don't know the customs, you don't know the language. And then people might take advantage of you, and I don't want that to happen. So we're going to try to arrange at least a couple of times to go with somebody we know with transportation, so you can get there safely, go do your shopping here and there, and then come back. We might have an opportunity to order stuff before we get there, probably in the next month, end of this month, I'm sorry, and August. We might have a couple of things that people who are interested, that real souvenirs, so we can get some people and then know the price and then you order them ahead of time. And some people usually order those, you know, like one size fits all, we call Dela. So people have comfortable something in the evening after working the whole day, just to wear something comfortable in the evening when we are catching up and updates for the days. You might have like a little light, so one light sweater or jacket in the evening. Sometimes it's a little breezy, and if we're going out that night, it might be a little bit chilly for you to need something to cover your shoulders and things. This is not a winter jacket. No, you're gonna sweat. It doesn't work that way. You might have a little small snacks. So people like packaged snacks, you know, like those graham crackers and stuff. I mean, animal crackers, if you are into that. Little cheesy stuff, that's fine, but not too much, because you're gonna take too much space on your stuff. We do have snacks over there, but it might be maybe a day or two for you to be able to access those things, because when we come in, we're arriving very late, or very early, I should say. It's like 3 in the morning. So we have to have little snacks. When we get to the hostel, we're gonna make arrangement that probably get the breakfast and then go and sleep for 3, 4, 5 hours, whatever. And then in the afternoon, we can have, we can meet the leaders from other, I mean, all the places that we're gonna go. So if you have a little snack and people like to have snacks, maybe you have diabetes or something that you need to have something to eat, it's okay. You can pack your snack. As long as they're in the package, you should be fine. And of course, if you pack on the check-in bags, that's fine also. And then people who are going to be doing sports, I mean, as I said, the comfortable clothing is fine. Remember, you're going to be outside and it's hot. So if you're thinking like weather for Florida, the way it's hot, direct heat. Remember, Tanzania is on the equator, if people learn geography. So equator is just direct heat. So if you're outside, you're going to be burning, sweating. You don't want to wear things that are going to make you hotter than necessary. So making comfortable clothing and stuff, we're going to share that schedule with you guys. And in fact, we have a meeting for people with doing sports today in the afternoon, just to get the logistic stuff. And then so you know what exactly we need to do. We're going to discuss a little bit more of that. And of course, as I said, you're going there, like showering stuff, just bring your sandals. Sometimes people don't want to walk barefoot in the bathroom or in the, that's okay. You can wear those in a hotel. Or if we have a meeting at the end of the day, you just wear your sandals, go to get dinner or something like that. So instead of wearing shoes all the time. But that's just, if you're going to the beach. So you don't want to wear your shoes in the beach because it's going to get wet. So if you have sandals, that's fine. And I said, this is not a complete list. It's just ideas of how things you have to go. You're not going to pack like if you're going to the vacation. No, we're going to work. We're going to have those little moments of vacation kind, but you're going to work. Okay, let me see. Oh, any questions about that part so far?
I don't have a question, just a comment. I would just like to say that the hostel is actually like right in downtown. So people, if you happen to forget to bring something, I would not stress too much, because you'll be within walking distance of a supermarket and stuff like that. So I think, pack as much as you can, but if you happen to forget, Dar es Salaam is a city, there will be, supermarket close to where everybody will be staying. So don't freak out.
Okay, so then thank you, Dr. Samichaka. So then I need to share this quickly where we're going to be staying. Remember, this is just a little, do you see the room there?
Yes.
Yeah, so the room is like, I mean, they're adequate for what we are going to do there, but so that's one room, that's one bed. Remember, we were asking people to share. So if you don't want to share in the, to share a bed with somebody else, then you can have, we're going to give you the price of that. You're going to have to pay for the individual rooms. And then so they just give the picture around the room, and then they do have a toilet, hot water heater there, and then the real shower on the left side there. And then so every room is almost like a dormitory, but it's just on the either side of each room. So there's a lot of us, so we're going to probably take the whole floor or something, like maybe 2 floors. It depends on the availability. I mean, we are still talking to them and they're working with that, because I told them we need to be at least as close together as we can. So if we are going somewhere, we're working together up or down to the hotel. And then as I said, in the bathroom, there's a sink in the toilet and then the shower on the next side. I think that's the same picture they show us. Any questions about the hotel? I'm gonna probably link you with, send you the link. Some people like to see from outside. It's nice. We selected that part because with security and what Dr. Msambichaka just said, it's right in the middle of the city, but it's secure enough that not everybody else can just get into there. But also it's in the middle of the city that if we forget something, we want to grab something quickly, and then you can go with, don't live by yourself. Please let me know. We're going to give you guidance and put the people that they can help you around. I mean, of course, Dr. Msambichaka, Dr. Fabian Guido, Mr. Prank, and myself, we are right there, and we've been there before. Miss Christine also was there before. So at least we have some ideas of what exactly we can do and not do. So don't just live by yourself. I mean, like if I can't help you at that moment, maybe I'm doing something else, so there will be 4 or 5 people that you can grab and say, okay, what about this? Can I do this? Or may I go now? Wait. And then so we want to make sure you wait until so we make the arrangement. And as I said, wow, as we get close, we tell you like, okay, maybe Wednesday evening, that's people will be doing shopping. So if that something is happening on Monday or Tuesday, you can say, can you wait until Wednesday? So you'll be able to come in and do whatever you need to do, or shopping or something like that. because maybe we might find from the hostel that they can accommodate you without you going out to the city looking for staff. So we just need the communication has to be very important, because if you don't know the language, you don't know the people, you're going to become a target, and we don't want that to be happening for you. Let me see. Okay, let me go back to my screen. Then I'm almost done with that document, so we can. So I know everybody's keep asking me, okay, what am I going to do? Or if I'm not a healthcare worker, you're going to do a lot. So right now, for example, the workshop, we're going to do the training from Tuesday to Friday. Majority of you are going to be at the hospital, so which is called Muhimbili. That's a referral hospital. So there's a, we're going to try and train 400 healthcare workers for those 4 days. That means 100 care workers for 1 day, for 4 days back to back. So what we divided that training is like the morning session and afternoon session. Morning session is going to be 4 hours. We'll be able to do from 8 to 12 and then from 1 to 5. So those are tentative right now. So we are still talking to them. If they tell us the a possible schedule should be 7 to 11 and then 12 to 4, then that's what we're going to do. But right now, each session should be 4 hours. And then within those sessions, there'll be 2 training. One with the Help Baby Breathe, and then another one is postpartum hemorrhage. So Help Baby Breathe is 2 hours and postpartum hemorrhage is 2 hours. It does not mean that the training is going to be for 2 hours. It might be an hour and 45 minutes, because we need a break in between. We put that way for purposes, for staffing purposes. If they say, okay, I can do only Help Baby Breathe this morning, but I cannot do postpartum hemorrhage, so then at least they were allowed for 2 hours to come and do that part and then schedule postpartum hemorrhage for another day. So that's the tentative. This is just like a little skeleton. So it might be like just revise something because it happened or whatever for the scheduling purposes. People who work in healthcare, you know, things can change. So we have that just a skeleton. The same thing that is going to be taught in the morning, the same thing is going to be taught in the afternoon. So we do have other training for the burn unit and wound care and stuff, and also for the anesthesia, because that is a small group of people. Then those can be done individually in the unit. So then that one, once they tell us what the days are feasible for those training. So we're going to notify Dr. Gwen Randall, and so she will be able to focus on the anesthesia department specific of those areas for those 3 hospitals. We are still working on them to find out if she can do 2 days either in Muhimbili and then 2 days in Mwananyamala, 2 days in Buguruni. So that's the part we are working on. So yes, everything is, whoever is going to be working with Dr. Gwen Randall, it's going to be like we'll make arrangement for transportation. We're not just going to leave you somewhere. So it'll be like that morning, you take the shuttle from wherever or Uber from wherever you are to the hostel, to the hospital, and then you go and do those training. And then of course we make arrangement for lunch and come back to the either hostel or come back and join us to Muhimbili. But as I said, all those logistics are still being arranged, and it will be completed before we leave to go over there. And then of course, for each, like the member said, the first 2 hours for Help Baby Breathe, we need 10 stations. So because when you're teaching, the facilitators, we work with 6 people. So it's almost like 60 people per session in the morning and 60 people in the afternoon. So remember, for scheduling purposes, maybe Monday and Wednesday is better for them than Thursday and Friday. So maybe Monday and Wednesday might have 120 people, and then Thursday, Friday might have 80 people. So we're gonna work with them as much as we can, because they have to put staffing scheduling also included in that schedule. So the same thing for postpartum hemorrhage, we might need 5 stations or 10 stations, so it depends. We did see the room that they're gonna use for training is beautiful. They have fancy chairs more than my class. This is not fair, but anyway. They have, the room is big enough, and then for the audio and stuff there, they can accommodate all those things easily. So it was very nice to see. Yesterday we had a meeting with them. So postpartum, yes, it can be 5 to 10 sections. So also depends on how many the mannequin we're going to get for teaching purposes, because those are expensive. So if we are able to get 5 of them, so it's going to be 5 sessions, but with 2 groups for each mannequin or which section. So, but you're going to get more details when we assign you. We have all the facilitators in each section. And then we add more people who are non-healthcare workers to add. Probably maybe each session might have 1 or 2 non-healthcare workers, because we're going to work with the registration, we're going to work with the certification, we're going to work with the knowledge assessment. Those, you can help us. Okay, somebody is training, as soon as they train, they come to you and you help register them and making sure they get what they need, the pre and post information. So we're gonna need non-healthcare worker more than even nurses, sorry, healthcare workers, because healthcare workers will be busy teaching. Non-healthcare workers are going to help with the logistic and administrative work. So, and that's why, thank God, we have a bigger group now. We're going to put you to work. That does not discuss that we are not going to be in the school. We are going to be in school. Dr. Vanessa Stenville is going to do the vision screening. So we are working with that part. She is going to be there for the first week and the second week. And then because she have to do the screening with other optometrists from Muhimbili. She's going to work with them. We are still working on those logistics, how many hours that she can be at the hospital. And then probably the second week, that's majority of the people, non-healthcare workers are going to go to the school, because remember, we have to still teach the hand washing, dental hygiene, health screening, nutrition, and physical activities. So we are still working, as I said, the schedule will be developing. And thank you, Maricela, for working so hard to try and put it in Excel spreadsheet, where we can get all the names of the healthcare workers and which session they need to be. So once Madam Zura agrees to what we suggested and what we're going to give it to us, so then we're going to publish it. So you know, like, okay, I'm going to have 2 doctors and 8 nurses. I'm going to have 2 doctors and 4, 5, 6 nurses. All those things is going to be known before we get there. And so people who are non-healthcare workers, we're going to run through that schedule. The end of August, everybody's going to know, okay, I'm going to help. I'm going to be in the group before Dr. Msambichaka's group. I'm going to help with this and this and this and this and this. But remember, if Dr. Msambichaka is teaching, she is not going to be registering people. She's not going to get their certificate. She's not going to be doing that part. Somebody else have to do that, because she will be finishing one session. She's going to the next session. So that's why we need the non-healthcare worker very, very much, because you guys are going to help us so we can stay afloat and make sure we do. And then remember, the schedule is very tight. So we're going to be running through very quickly, because one session is done, second session is done, and we go for lunch and then come back to third session and fourth session. All those things have to be like running like an oil machine. So we're going to run through and have the dry run before we get there. So everybody knows their spots and everybody needs to know what they do. And then transportation. The first maybe 3-4 days, you're going to go to Muhimbili and you're going to be leaving at this time and you arrive at this time and come back at this time. So everybody's going to know those things. So don't worry about that part. We're going to give you more information as they get confirmed, because the biggest part now to drive our changes is what they can afford to pull people out of their work and bring them to training. So once they tell us exactly finalize names and everything like that, then we're going to finalize that part. We do have the names of all those people. Muhimbili is going to give us 220 people, Mananyamala 95, and then Buguruni is 35. So if you add them up, you get like 390 something. So I put 400 just because you never know, they might have new hires or something like that. So 400 is easier to do the math versus 393, you know, so. But anyway, so those are the training. Just be aware that you're gonna know what exactly you need to do for that time. So don't worry about that part. And then so people who are gonna be do the school and the physical activities. So during the meeting in the afternoon today, we're gonna discuss it, but just to give you a heads up, yeah, so we're gonna do probably 2 or 3 days for the Magnet Youth Association. This is elite soccer team. We're gonna have in the evening. So school ends early, around 1 or 2. So then those people who are going to do the exercise, they will come from there, go straight to the school and to the sports center to go and train and do all those workshops and drills and stuff. But all these things you will be planning way ahead. You know, like whether it's Tuesday, Wednesday, Thursday, or Monday, Tuesday, Wednesday, we know ahead of time. And then so there, we're going to be teaching the nutrition, mind injury preventions, and then those will take like an hour. And then the second hour, that group will be talking to the parents and staff to, you know, like discuss what the issues they have with training the pediatric population. You know, there's so many issues, eating and hydration and injury, and then the kids needs to be able to report if they have any issues, whatever this the screening. If we can do the screening and if the time allows, then yes, we'll be able to probably adding some of the healthcare workers to go and do those blood pressure and height and weight and BMI and stuff and educate that part. But that one is going to be added, and we know, especially the second week, because the first week, all the healthcare workers going to be at Muhimbili teaching all those healthcare workers, those 400 people. Okay. So I wanted just to, when you're thinking of the school, I wanted you guys to see just a few pictures of the school. Okay, so this is just the back of the school where we are going. So this is between the aisles of the school. You can see the school is not, there's no fancy thing how to describe the school. The school, that's how it looks like. This is one of the middle between the classes and where the students are. You can see them, they're resting outside the classes. You can see this side, I mean, this one class and the second class, and then there's another class here. I mean, the things are run down. That's how the school was selected because they need help. And then part of it, and then this is just part of the communities like right there, and the school is like that. So the safety and everything else is included in these kids who are coming to school. This is on the other side. So it's like almost 2 or 3 hours of the buildings and stuff. And then, I mean, there's no like glass windows and something. It's just like you can hear the air, you can see the air comes in and out. And then this is just the name. The name is called Minazini. I think there's one screen you'll be seeing. So unfortunately, this used to be the cafeteria for the kids. So usually they used to cook food for them, you know, it's a suit and all this blackening stuff. And we were thinking of trying to get these children breakfast at least for a year. And we're still working on it. Maybe this time we might not be possible because it requires so many things. People who have worked with children, there's so many permission that you have to go through for the government to even allow you to feed these children. So there's so many things we are working on those behind the scene to try and get the permission. And then once we get permission, when we see these pictures, we say, no, this is not going to be acceptable for us to serve that breakfast to these kids. So the breakfast we were talking about is almost kind of like oatmeal, but enriched with nutrients that Ms. Teresa and Ms. Christine Behoniak, they were working on to try and see we can give them a better nutrition start for these kids, because remember, if the kids are not eating well, chances is they're not going to be learning anything. And then so according to Ms. Claire, one of the teacher who we started working with her during this project from the beginning, she said some of the students pass out maybe around 8 or 9 because they come so early in the morning at 6 in the morning. By the time it's 8, 9, they have not eaten anything from home, they pass out. And then sometimes the teacher, we have to take their own money and buy tea. And remember, tea is just plain tea. It's not like flavored milk or whatever. No, it's just black tea, like a black coffee. So you give them just like that. And then remember the teacher used their own money. So yes, it will help, like, you know, because especially the kids were hypoglycemic and stuff. You give them like, but how long does the tea last? They don't eat lunch at school, so they come at 6, I believe, start cleaning up the school, and then 7 o'clock this class starts. And I believe like around 12 or 1, the early class, like first grade, I think, to the second grade and the kindergarten go home, and then 3rd to the 7th grade stays until 2 o'clock. So remember, the child is from 6 to 2 o'clock have not eaten anything, and then they send them home. So that's why we were like, okay, so if we try to help provide breakfast for these kids, then at least they will have one guaranteed meal. And then in that part, probably we help with attendance, we help with the learning, we help with, you know, like a growth, because these kids need to grow and then to be able to function as effective at that. So that process is still working on. If you know anybody who can give us like $50,000, we'll feed them the whole year, those 830 kids breakfast. So if you know anybody who has the money under the mattress, you can help us, please. just let me know. We send them the letters and pictures. So that's the name of the school, Minazini. This is one of their toilets. Yeah, so some of them have water, but water sometimes it runs out. So it is what it is. And then this is one of the side of the going to the bathroom, I believe. You can see it's run down. So they try to patch to try and protect people from outside coming inside. This is another side of the school. You can see the water tank there. And I think this is side of the cafeteria. Some of the classes are there. And then, so this is like an open area. So if it rains too much, you can see it's just filled out with water. And so it's challenging. So wherever we can help, we will help. And so if anybody knows somebody who can help, that would be a great project for these kids. So this is like one of the days that they have rain. And then so the kids, we have to like shuffle running from one wall to another. to escape from getting wet. And some of them will take off their shoes and walk on the running water to go to the class because they need to go to class. So they don't say, oh, because there's water at school, so I don't have to go to school. No, you still have to come to school. So they're resilient, and these are the kids that they really have hard time, but they still go to school. So we need to help them as soon as we can. And then, so this is the office for the teachers. You can see, I mean, their desk are run down, but they see the teachers show up and their bags and stuff to help the children there. And yeah, so imagine if you're a teacher, can you go to school and work in this environment? But they do. Okay, so any questions? Okay, so the last one is estimated individual budget. I said this is just a sample. And then so I am gonna work with individual people to see what exactly you need to do and how much you're gonna pay. So this is a sample for me. And what if I was to pay today, this is what I'm gonna be paying. So thank you, Maricela, for organizing this and look so fancy, and I look so professional today when I'm using this. So we want young people to come and work here at the QHSC. Anyway, so for example, my ticket is $185, visa will be $100, my insurance it was $45, and then food and shopping. This is like either as we go through the transportation, sorry, as we travel and we get to going back and forth to when we're in Tanzania, that's 75. Then there's another 75 paying the transport to go to safari and come back, but I will show you the breakdown. So then medication, we just put that $50. It depends on how many like a prophylactic are you getting, and then with the insurance, it might be less, it might be more. So that's just a sample. And this you're gonna pay. You're not giving me. You're just gonna get medication from the doctor when they give it to you. So this was temporary license that we had before. They said we just got the finding that we're not doing that. So June 12th. So we're gonna take that one out. I'm gonna show you in a few minutes. And then so accommodation, so for 13 days for one person, if I'm staying by myself, this is the 390. But if I'm sharing, so the second person will add the $7 there. So if I'm sharing with somebody else, I mean, Mr. Prank, so we can divide this in two and then have our fare, I mean, our fees go down because I'm sharing with somebody else. So if somebody is an individual, is going to pay, because each room is $30 per night, and we have 13 nights there. And then this amount is going to be there. So if you keep going, oops. So the safari, so we have two events in the safari. We're going to go to Sadan, which is like a national park right there in Dar es Salaam, and then we're going to go to Zanzibar. So just to people who wants to go and touch Indian Ocean. So those two events, as an individual, if you go both places by yourself, I mean, stay in the room by yourself, we're going to pay $395. And if you are sharing, so the price is $370 per person if there's two people. So you save like $20 there. And then so it'd be like a $370 for people who are sharing. So it's gonna cut at least $25. So the Mr. Lamek, the guy who is helping us with all the safaris back and forth, he has volunteered to pay $60 for every person who is going to this safari and Zanzibar. So I put it in red, so I'm going to take it out and then you see the amount that is going to show up at the end. So I'm just putting it there so you can see it. And then so, but still we have to pay the amount from Zanzibar to come back on Sunday. So that's the $6. So this is $60 is the ferry, which is like the second class. So there's like a VIP and then second class and then the general publics. We don't want to go to the general publics though, because that's just everybody sit on top of each other. No, we don't want to do that. We want the second level, which is, I don't remember the name exactly, but yeah, it's called just, it's not a VIP. No, yes, the VIP, and then the Royal is the one which are paying $80. We don't need the Royal. But the $6, everybody's going to get the seat and you get a little bottle of water and then we travel. The ferry is like an hour and 15 minutes, I believe. So then you go to Zanzibar and then come back the next day. But going to Zanzibar, he's going to pay for us. Thank you, Mr. Bamik. And then we pay way back. And then the $25. So when you're coming back from the Zanzibar we need to get lunch first, and then because the ferry is going to be in the evening, so we need to get lunch because by then you already check out from the hotel. So this amount is going to cover what you are paying. It's going to be covered with the fee from Dar es Salaam to Southern to Zanzibar, and then but the $60 we have to pay ourselves to come back. And then this is the lunch going to Southern because it's not included in that part. The $60 is included in there. And then meals outing. So we're gonna go outing to eat dinner, a couple of places. We're working on it to make sure they can accommodate 33 people. So per person is only 25. So just in case, for example, if we say we don't go to those places, or we go to those places and somebody has to volunteer to pay. So that is the $25. Either it's gonna be reimbursed to you, or if there's something that we want to do while we are there, it's out of this budget, then you'll be notified, and then either it will be credited to you or will be used. And then when we are in Dar es Salaam, going to those transportation from hostel to each location, like either you're going to the hospital or you're going to school and coming back and forth transportation for all those 14 days is $100 per person. So that part also is included in there. So Miss Maricela did your fancy stuff. So without a discount, anything else, so I will pay $27.94. Remember I said last year we did it $28 and $80 for per person. So now if I take it out, oops. Oh, I need that. I don't need the license. And then so for people who are not staying for the event, the Iringa event, people we know who are going to the wedding, so that 150 is not going to be there. If you're going, it's 150 there. So the amount now is 26 and 34, but that's on including if you're going to the wedding. So if you're not going to the wedding, if you take that one out, oops. It's going to be only $24.84. So that is just a tentative. Remember, this is the one person who is staying on their own, no discount. So if you're sharing a room, it's going to come down. If your ticket was cheaper, it's going to come down. If your insurance was less than mine, 45, it's going to come down. And then the room and board at Luther House, if you are sharing the room, it's going to come back down significantly because you are the second person for them is only adding $7 versus the $30. So if you're sharing a room, this one almost is going to cut close to half if you're two people are paying. And that's why I said I will have to talk to individual people. So for me, for example, it's 24 here, but then you get more discounts. Majority of people are going to pay way less than that. Does that make any sense?
Yes.
Okay. So, I mean, I am even happy that I see that number is very, very low. Because otherwise, yeah. But we are grateful for people who give us a lot of discount. And as I said, if there's anything that is going to change from now until then, we keep you updating and let you know if you need to be credited or we leave it those money for emergencies. And then if after the trip we don't use it, then we just give you back your money. That's fine. And then so sometimes we do have the expenses for the transaction because we're changing dollars to shillings. Sometimes you have those transaction fees. So most of the time when we have that amount of the money that we estimate, it usually should cover that part. But it's very rare that we exceeded outside. And then as I said, we're still negotiating all this time. So we're gonna continue negotiating. We wanna pay less than that if possible. But I believe the majority of the people will pay less than $24.84. That's including your ticket, your visa, and everything like that. So if you take the visa out, you're almost paying probably $1,100 for just the all the 2 weeks food and everything is in Tanzania, which is unheard of. But that's how it is. Any questions for me now?
Yes. So I was planning on getting some shillings to go over there with for my bank. How much would you think we should get?
I think Miss Christine had a very good answer last time. Miss Christine, because she was there in the medical mission. Ms. Christine, do you want to answer that?
Sure. Can you hear me? Okay.
Yes.
Yeah.
Last time we went over, and I believe when we first got there at the airport, we got some, exchanged some money, and I exchanged $50 worth. And then later we had another opportunity to exchange, and I exchanged maybe $20 or $30. And then I still had money left over. So I definitely spent less than $100. The second time I went, I spent more, but I I had my laundry washed, which I did not realize. I thought it was free, and it was not free. So I had to have Dr. Gabone help me with that translation. But I ended up paying a lot more for laundry than I thought I was going to, so I needed a little extra. But you should be fine with 100 or less.
Thank you.
Mm-hmm.
So I think majority of the time, usually the money people need is for shopping. And as I said, we try to cover as much as we can to certain things like transportation, food. When you go out, at least it's covered. I mean, we don't cover alcohol and anything. If we go to a fancy hotel and you want, restaurant, and you want to pay for the alcohol or something like that, you want to test it, that's fine. You're going to have to pay separate. But if we plan and we're going for lunch, then more likely we're going to cover that part. And then because we want people to enjoy the experience versus worry about what we need to pay for this, what we need to pay for that. Dr. Msambichaka?
Yes, the other thing I wanted to add is $50 and $100 bills is probably what I would recommend you go with instead of like $20 bills, just because the exchange rate is higher if it's a $50 bill or $100 bill versus a $20 bill. The other thing is make sure that your bank is notified that you will be traveling during that time, because I would say probably don't exchange too much cash, because if you have extra Tanzanian shillings, they will be useless for you when you come over here. But you can use your bank card in certain places to make purchases. And that will be, obviously for better or for worse, you might end up spending more money because now you can just swipe. But also it will also just give you a peace of mind if you went to a supermarket or somewhere, or a restaurant, and you needed to pay and you didn't have enough cash on hand.
In fact, thank you for reminding me that. But yeah, so the $20 versus the $50, yeah. So when you go to the bank, Bureau Bank, you see it says if it's $100, this is exchange rate. If it's $50, this is exchange rate. If it's $20, this is exchange rate. So if you exchange too much and you cannot use it, you know what? Let's go back again to Tanzania next time. You will have the money ready to go. But the other thing is, you can use your bank and then just asking them, as long as they don't have transaction fee, because there are some banks we have international transaction fee. Every single time you swipe, there's $2 or $3, $5 taken out. But majority of the bank, if they know ahead of time, they will waive that, so you can continue using the card without getting that penalty. And then they do have ATM banks or machines over there, but they charge that transaction fee. If you get it. But if it's necessary and you have to have cash there and you really need to get whatever you need to get, then that's fine. But if you can plan ahead, yes, clear with your bank so they will know the dates that you'll be traveling, and then so you don't have to pay the international transaction fee. That would be great. So as I said, Dr. Samichaka said you might start getting swipe happy to try and buy stuff, which is fine. I mean, people buy the souvenirs, people buy the clothing and stuff because Tanzania have a beautiful clothing. So you can buy those stuff, little carvings or little decorations, just a little bit to bring it home to give it to other people. So then you say, guess what I found in Tanzania? So it's those things, little unique stuff that you can't get anywhere else, and you might get them from there. So yeah. Miss Christine, you want to say something?
Yeah, I just wanted to add another thing about the whole money issue and everything. Okay. There's also, I had a fanny pack with me, you can bring that. Or there's also, there's a band that you can get on Amazon, and it just fits around your waist and it has pockets in it. And that way you can carry your passport, your money, your credit card with you everywhere you go, which is a smart thing to be doing. The only thing I would caution about the band around your waist is I had that in Mexico and my room key fell out of the back. There was a pocket and I ended up losing my room key. So that might be a little less safe than the fanny pack.
Yeah, so and thank you, Ms. Christine. Yeah, because the fanny pack, you do need your passport, because remember, you need those documents that if you have to be evacuated, nothing will happen. But if you have to be evacuated, you have to have those important documents with you all the time, everywhere you go. Because sometimes it might be hard to go back to the hostel to get those stuff. So, but you have to have those valid documents with you. And then if you have the fanny pack. And if, Ms. Christine, if you have a picture of it and we can post in the group, that would be great. So people will see how it looks like. I know Ms. Maricela, I don't think she has any issue with that because she has those.
I'm telling you, it's like a lifesaver. I think it's like a lifesaver at clinicals. I'm taking it with me to Tanzania, matter of fact.
If you can take a picture and post it to people. So yeah, I see that.
Yeah.
It looks really nice. I mean, so you have your organizing stuff right there everywhere you go. And then so you don't, your hands have to be free because whatever you are touching, you don't want to keep touching and reaching over for your stuff, no. But you have everything with you. Like you don't pack too much in there, but all the just the necessary document and the little shillings there just in case you go through and say, oh, I like this little thing, whatever. So you can see on your way, something like that. So that would be good, yeah. Anything else? Ms. Kassan, do you have anything else? You have any question?
Oh, no, that's a lot to absorb. But what time is the sports meeting today?
At 2.
2 o'clock. Okay, thank you very much.
You're welcome. Bree, any questions? Are you ready? Did you pack your stuff?
No questions.
Oh, okay. Ms. Teresa?
Oh, I had a quick question. When we're at the hostel, is the water in the room like potable? Like, can we drink that?
No, we mean like when you are working at the hospital?
Oh no, I'm sorry. Like in the hotel.
We're gonna try to get you to drink bottled water, and then so I have to go and find out and confirm with them first to make sure. And usually I have to see the rooms and stuff. Dr. Msamichek, have you been inside the hostel?
Sorry, no, I have not.
Okay.
Yeah, I would confirm before I said we can safely drink the water.
Yeah, we're gonna try to get as much water as we can, the bottled water as much as we can, because I mean that's the only way I can guarantee that the water is in the bottle at least. So we usually get a lot of you know, like those
Cases.
Yeah, so not the smaller ones. We usually like for people to put in a room at least those big ones, like almost like 32 ounce. So if you have that, at least you sip through it. But if you're going to the hospital or to school, we're gonna have our own, those cases with us to make sure people have something to drink. Yeah, because it's gonna be hard. It will be hard. And I want people to, please don't, because we're gonna pass out. That is the direct heat and it's dry air. I mean, think that there's not much humidity, but it's still a dry air and the heat. So you do need to drink. You're gonna get dehydrated very quickly. And but remember, we're gonna be working a little bit harder than, because you're gonna be like running around and doing stuff fast. Especially people who are doing exercise, please drink because you're staying outside and we don't want people to hear somebody's passing out and start going to send you to the hospitals and stuff. No, we don't wanna do that. Anything else?
I have one question, Dr. Gabone. Hello, everybody. This is Brenda. I'm on the video. Hi. Can we bring Roman noodles if we're not a fan of the dinner one night? Can we pack the dry noodles and bring it with us?
You can pack it, but then are you gonna eat that without cooking it?
Oh, we can't cook it there then.
Hot
No.
water.
Yeah, I don't think so. Oh, you mean like hot water, asking for hot water, and then you just put it in there?
Yes.
I mean, I would say you can pack it, and then just in case, because I don't think they have microwave. Probably the hotel in Zanzibar will, but I'm not sure the one in Dar es Salaam has. But I can ask, and then I will answer you that. So microwave.
No worries, Dr. Thank you.
But I think you can pack a couple of them just to dry, because just if you don't eat, that's fine. But if you eat, there's a lot of food. There's a lot of varieties. So, and then the food is like a buffet. It's not like whatever is cooked, that's why you have to eat, but it's buffet. And then we already start telling them, not mixing stuff, so we can mix ourselves. So if let's say I don't like this, whatever, I'm gonna eat a few other things. So we already told them like the meat section should be here, the vegetable should be here, the fish and stuff, you know, so don't mix them up, because some dishes require mixing just to make the specific dishes, but I told them no. Or if they do, the mixing part has to be a smaller portion, just in case not everybody can eat that. But yeah, so it's going to be a little variety. So if there's something that you do not eat, any allergies, anything, I do need to know those things. So we can make sure that they address. If people don't eat meat, then I already told them that when they're cooking their vegetable and stuff, they should not mix with meat, because there's some people who don't eat meat at all. So which is fine. We, I mean, I keep telling them, they were saying, oh, can we make them pizza? I said, you can try, but your pizza definitely is going to be different from America, but well, it's going to be a Tanzanian pizza. So if they want to try, and sometimes they will try some dishes, because we're going to be there for 2 weeks. So they're going to try to put them some dishes preferable for the guests. So if they offer something and then you like that, but you can mention that maybe next time when they're fixing it, they might have some options for you. But what I need to know, they need to know allergies. And then if people, like, for example, I know one of the person have to eat like gluten-free. So I told them, like, if they can give me options of things that they can eat, so to be sure. If not, then we have to try and accommodate as much as we can for type of the food that that person can eat. So if I know ahead of time, they're willing to work with that, because they know we're being a huge group. So yeah.
Thank you.
You're welcome. Anybody else? Everybody's ready?
Yes.
Good, that's what I wanted to hear. Oh. Yeah, so this is things that I have so far, but please, if you have any question, just let me know. But please submit your stuff as soon as you can, because we need to make sure everybody is squared away. We address as soon as we can. So by the time we get to go, everybody's ready to go, because we don't want to find out the last minute that things are missing. And thank you, Maricela and Bree, for helping me to get more organized stuff for this document for 32 people. It's crazy, but it's exciting and it's doable. And so we have all the extra hands we can get, that'll be fine. But I just encourage you guys, ongoing donation, fundraising, if you have family members who have helped you to support your mission and the trip, that's great. And if they want to donate those like thermoregulation stuff, we do have some onesies and stuff, but we need, I'm going to post by the end of today, I'm going to post the updated list and see how many we need, because we want to make sure every single baby who is receiving thermoregulation training receive the whole set of all those things we want them to get: the hat, the blankets, the onesies, the cloth diaper, the cover diaper, and the booties. So we are getting there, and mittens. So we are getting there. So we need to get them, because those are 3 hospitals and there's so many babies. And we don't want any baby left out. So if we can, that would be great. If you can help with the notebook and stuff for school, that's fine. I believe the pencils, we reached the number. Toothpaste is left, probably halfway, we're halfway there. So as I said, I'm gonna post them update and stuff, so we can continue gathering the equipment stuff. Okay, that's all I have today.
Thank you.
You're welcome.
Thank you.
You're welcome. Bye.